Good day, everyone. Welcome back to Real Talk Nurses in the Know, where experienced nurses are interviewed to talk about current and pressing issues faced in the workplace. Today, we are taking an in-depth look at our speaker's journey by raising questions on her insights on matters of workplace safety and security. And to welcome our guest speaker. Our guest speaker is Grace M. Capili. She is currently working as a senior church nurse at King Fahd University, Dhahran, Saudi Arabia. She will be asked a total of 5 questions, which will be responded to accordingly. And to start, for our first question,
what is the current status of occupational safety in your institution? In terms of the implementation of policies in protection of healthcare workers, incident of occupational injury or illness, and safety concerns.
The King Fahd Hospital of the University has been actively implementing precautionary measures for all healthcare workers in accordance with the hospital policies and procedures and standard protocols. Being a Joint Commission International JCI accredited hospital, the KFHU Facility and Safety Management Division governs the policies, procedures, and protocols to primarily ensure patients and all employees' safety. The said hospital division also answers for any safety concerns that will be raised by the institution.
wow! It was good to hear how your institution mobilized their resources and management to ensure and implement worker safety. And now for our second question.
How is workplace safety being implemented in your institution? Can you state to us the measures and the strategies being conducted to address the issue?
As part of the preparation for any occupational health hazard that may cause injury or illnesses to hospital employees or patients, the institution provides all employees with proper training and orientation on how to prevent, manage, and implement safety precautions and measures at all times. For fire prevention and management, for instance, the hospital is equipped with fire extinguishers, fire hose, and fire alarms, of which all staffs are oriented on its physical location and are annually trained on how to utilize such safety equipment or apparatus. In addition, the hospital also provides needed equipment or assistive devices that could facilitate immediate evacuation whenever necessary.
All I can say is that proper nurse training and education truly play a part in ensuring that policies for worker safety and security are met in the institution. And now, for our third question.
How do you think these measures and policies affect nursing outcomes and quality patient care? Can you give us some examples?
In terms of nursing outcomes and quality patient care, the readiness and knowledge of first responders to any occupational hazard incidences is highly valuable. As a nurse, since we are basically available within our area of assignments, of which the welfare of our patients and our colleagues are highly prioritized, we will be able to save more lives whenever disasters might happen to our institution. Without the proper knowledge and training provided to us, staffs will not be confident in attending disaster response, and this will greatly affect the outcome of the safety and security within our premises.
The pandemic has devastatingly affected the healthcare system, including the safety of both the patients and the healthcare employees. But proper implementation of occupational health through education and training has reduced the probability of such incidents. And for our fourth question,
Given the situation of the COVID-19 where new health protocols are implemented for the staff and the institution, how did your hospital institution proceeded to ensure safety and security among its workers?
Being a government hospital, the institution is immediately receiving first-hand information from the Ministry of Health in relation with safety and security protocols that needs to be implemented. During the peak of the pandemic, cohorting patients was instantly implemented to avoid nosocomial spread of the COVID-19 virus. This was performed in order to maximize the limited supplies of protective equipment which is vital for all healthcare workers who were handling infected patients. Moreover, vaccination program was made mandatory for all healthcare workers and other frontliners immediately upon the availability of the vaccine. All hospital staffs, including the patient and the relatives, were also required to utilize Tawak na application for the health status monitoring purposes. Staffs who failed to show the evidence of completing the required doses of vaccines were not allowed to come for duty for their protection and safety.
Nurses deserve to have a safe environment to perform their tasks. Measures facilitated, such as the administration of vaccines, is one step to carry through protection to its staff. For our fifth question, as a senior church nurse, how do you make sure that your staff nurses feel safe in their workplace, especially now that we are in a pandemic?
As a senior church nurse, if it comes into my attention that any staff presents COVID-19 symptoms, I have been giving instruction for the staff not to attend his or her duty and advise him or her to seek medical consultation in the Employee Health Services of KFHU as per hospital protocol. This measure is being implemented to ensure that unnecessary spread of the disease will be controlled and or avoided, especially that this could greatly affect the quality of patient care during the understaffing. Moreover, proper communication with the nursing supervisor is also crucial during this period. It is also part of my responsibility to ensure that all needed personal protective equipment is readily available in my area of assignment.
Close monitoring and active reporting of incidents in the area is one way to minimize further progression of unprecedented cases of hospital infection. And your institution has considerably able to take full control of that issue. And lastly, for our sixth question, what are your recommendations for the institutions to further improve policies with regard to occupational safety and security, if there are any?
In terms of occupational safety and security policies at my current institution, I have no other recommendation except for the hospital administration to consider the possibility of providing hazard pay to all employees since the threat of the pandemic is still not yet over.
And that ends our today's podcast. We would like to sincerely thank our guest speaker for allowing us to hear your insights and experiences on matters of work safety and security. Again, thank you and have a good day, everyone.